And as we've been telling you, COVID infections rising over the past few days. And tonight on the Answer Desk, we're looking into whether vaccines are giving people a false sense of protection. There is some confusion and concern because those who are fully vaccinated are among the people testing positive. Chief political reporter Susan Raff is joining us now with some answers. Susan.
Erin, people are telling us that they're concerned. They got the vaccine, and when the restrictions were over, many say they felt safe. But now we are seeing those who are fully vaccinated test positive, and some are even feeling sick. So some are asking us if these vaccines are as good as they may have thought.
COVID cases have grown. Connecticut's positivity rate is inching up. The culprit, the Delta variant. But Connecticut also has a high vaccination rate. Shouldn't that protect us?
The problem is our perception of what the vaccine was actually supposed to do. We always thought that the vaccine was supposed to stop transmission, and we knew that it does reduce transmission to a certain extent, but the main goal of the vaccine is really to prevent severe disease.
Breakthrough COVID cases are rare, but what happens if you are fully vaccinated and you think you've been infected?
If you've been exposed, you should probably get tested, and you should probably test twice, actually. One at the time that you found out to establish your baseline, basically. And then really it takes a couple days for it to incubate. So days 5 to 7, would be when your maximum infectivity would be at that point.
Now that most restrictions have been lifted, many are going out more and traveling, some to states where vaccination rates are much lower. That freedom comes with risks. Governor Lamont hasn't decided whether children will have to wear masks when they return to school in the fall, and he's not ruling out putting back some travel restrictions.
We haven't made up our mind on yet. We're thinking about it, but you're right. We got states like Arkansas and Missouri and Florida where the infection rate is 10 times ours. So it is something we ought to be looking at, and we will be.
Doctors say those who are fully vaccinated are much better protected, but nothing is 100%.
Are we ever going to get to a point where we're going to be okay and not have to get tested and wear masks?
Without complete buy-in, no.
What that really means is that while a 70% vaccination rate is certainly good, Dr. Wu says it needs to be higher, like 90%, for things to really get better. As for masks, he still recommends them when people are out in public places, especially with lots of people that they don't know. Susan Raff, Channel 3 Eyewitness News.